An aneurysm is an abnormal sort of saccular outpouching of a blood vessel wall. They start to pouch out, they start to expand. What we're talking about is the arteries of the brain. Aneurysms can be treated, and there's sort of two ways they can be treated. The traditional way is open surgical clip ligation, which is what a neurosurgeon does, where they make an incision, they remove the skull, they separate the brain tissue, they go down to where the aneurysm is, and they place a clip across the neck of it. The other way is what I do for a living, and that's treating aneurysms minimally invasively from the inside of the blood vessel. And so it's catheter-based technology. I'm going in the femoral artery down in the leg, and we place catheters in the leg that we direct all the way up into the blood vessels of the neck and all the way up actually inside the brain aneurysm. And once we have a catheter inside the brain aneurysm, we can actually occlude the aneurysm from the inside, and we call that coil embolization. What this is it's sort of a stent-like device that we use to place across the neck of an aneurysm inside the blood vessel. So we actually can place this very, very flexible, thin tube, which is very, very compressible. You can tie it into a knot basically, across the aneurysm on the inside of the artery without ever having to place anything inside the aneurysm itself. And that could be hugely advantageous for certain kinds of aneurysms. There are some aneurysms where the anatomy can only be treated in this way. And what this does is it diverts the blood flow away from the aneurysm. So what happens is the aneurysm will form a blood clot on the inside of it, scar down, and actually will shrink and can completely disappear. In the world where these have been used, they've been used in Europe and South America and the United States, there's not been a single case where an aneurysm has come back after treatment with this. It's very, very promising technology. The majority of aneurysms these days we try to treat minimally invasively because patients do really well from minimally invasive treatment.